When we look at the input and feedback we've had from students over the last few years in our course, there's probably a couple of themes that summarise the students' experience. The first theme, and by far the most important, centres around confidence and students feeling really confident by the end of semester about who they are as developing clinicians and really confident to go and put their clinical skills and their knowledge into real practice. When we look into their feedback around confidence, a lot of it stems from them feeling that staff in the course are really invested in who they are and their development and are really invested in seeing the students succeed. And this is really meaningful for us. We have around between 160 and 180 students in our course each semester, and we make a real concerted effort to make sure students feel valued as members of the classroom. So we make a concerted effort to do things like learn students' names, get to know them on an individual basis, but importantly we try and acknowledge and celebrate all of the perspectives they bring with them into our course. We're looking at really complex and quite confronting clinical content. We look at how to manage people who have chronic pain. So we know that students are going to bring in a whole range of experiences and diverse perspectives with them into the classroom. We use a case-based framework or a case-based curriculum in our course. And what this means is that we're following real patient cases right through the semester, even from day one. And this has been really important for building confidence because it allows students to enact that role of clinician right from day one, right through the course. And I don't believe we can create confident clinicians without actually giving them ample opportunities to enact this role and to practice in really meaningful and authentic contexts. The other thing too is that we share with students the uncertainties and challenges that come with being a clinician. We're all clinicians and we share with them that it's not about being perfect. It's about doing the best that you can in safe ways for the person in front of you with the information that you've got. And this more relaxed approach to health professional education allows students to feel more confident to give and receive feedback, seek help during the semester, and at the end of the day, kind of ask all the dumb questions. The last theme that's a little more practical that we hear from students in their feedback is where we've been able to provide really explicit and meaningful connections between new and existing content as we move through the semester. Again, we're talking about really challenging clinical concepts here. So we know that students are going to trip up along the way. There's going to be things that are confusing. So we make sure students have different avenues to be able to raise concerns or ask questions. So we let them do this in confidential ways through a Padlet, but mostly we try and create spaces in our classrooms where students can be comfortable to raise concerns and ask questions, and that dialogue is always welcomed. We have a relatively high response rate in our course, and when we talk about students' motivation for engaging in evaluations, there's a few things that come up that I think are really relevant. Firstly, students tell us that they feel through the semester that their values and their perspectives and their experiences are really valued by us as core staff. We're always welcoming their perspectives, we're celebrating how those perspectives change. We try and create spaces in our classrooms that are really open to dialogue, and students are an important part of how our course progresses through the semester. So we hear from students that because their perspectives have been so valued through the 13 weeks, when they go to undertake an evaluation, it's kind of not really a thing because they just see it as a natural progression of being able to contribute their perspectives. I think the other thing to reflect on too is that nobody likes doing surveys if they don't know the value of the information they're providing and if they don't know how that information is being used. So we share with students towards the end of the semester around reminding them of what CCATs are. Why do we have them? I talk about the value they provide for the course and also for me personally as a teaching-focused academic, what value they have for me both personally and professionally. But importantly, we let the students know how that information is being used. So I'll give the students a couple of examples about how CCAT feedback in the last few cohorts has actually led to substantial changes in the course that they're experiencing this year. I think that CCATs are a small but important part of getting feedback on our teaching. When we look at the best approaches to teaching in higher education, they often centre on social approaches to learning. And this is no different to when we're wanting to actually develop ourselves as teachers and get feedback and learn new skills. I really like engaging with others and teaching communities. And one way in which I do this is through peer reviews of teaching. And I like to do this in really informal ways. Peer review of teaching means somebody observing my teaching or artefacts of my teaching and having a discussion around that, or me observing them. I really like to do this in settings that are outside my area, which is health professional education. So I might go outside into other faculties or even into other universities and look at what they do. And settings that are different to mine might be small group teaching or even really large cohorts. And I find this really interesting to see the diverse ways in which different teachers in different settings engage students really effectively. I also really recommend the HEA UQ program. This is a really great way to reflect critically on your teaching practices and going through that process of thinking about whether your values of teaching and what drives you as a teacher actually aligns with the learning activities that you create and that you undertake. So I think overall there are many opportunities to get feedback on your teaching outside of just student evaluations, and doing these in really social approaches like in different communities can be really valuable.